Chicago parents of toddlers and babies are having to make tough decisions when sending their little ones to daycare centers. That's because the city's Department of Public Health is not systematically tracking COVID-19 outbreaks at those facilities as COVID-19 cases are rising. WTTW News reporter Heather Cherone joins us now with a look at what she found and how one Chicago mother coped with her son's illness. Heather, welcome back. First, tell us, what do we know about COVID-19 in daycare centers?
Well, we don't know much because of that lack of systemic data. Now, the Chicago Department of Public Health requires daycare centers and early childhood schools to report when they have had 2 or more cases of COVID-19 within 14 days. The problem is that's really a request. City officials can't enforce that requirement, and there are no consequences for not reporting it. The other issue is that that data is not available to Chicago parents who are struggling to decide whether it's safe for their kid to go to daycare. WTTW News was able to obtain some data which shows that there were 9 cases January through March, but even city officials acknowledge that is likely an undercount, which leaves parents flying blind.
So, Heather, why does it matter then that the health departments aren't tracking COVID-19 in daycare centers?
Well, if you don't know if COVID-19 is spreading in daycare centers, you can't reimpose measures like social distancing and mask wearing to stop that spread. And then you get a situation where you can have really several cases of COVID-19, up to a dozen, that could cause whole daycare rooms to shut down, making it impossible for parents to work.
So one Chicago mom, she was caught in this situation. Meredith Shiver, her 19-month-old son Carter got COVID-19 at the end of March. Eventually, Meredith and her husband also tested positive, along with a dozen children at that center. Here's what Meredith told you.
We did the most that we could to protect him, and it wasn't enough because we're not choosing as a community to do a little bit more to protect him.
Heather, did she feel let down by the lack of data and guidance from health officials?
She absolutely felt let down, and she was furious that this case outbreak at her son's daycare in Lincoln Park really happened at a time when city, state, and federal officials were removing measures that have been proven to stop the spread of COVID-19, really leaving kids like her son, who's too young to be vaccinated against COVID-19, to bear the brunt of COVID. And she's concerned about the long-term effect of COVID, and we don't really have any of those answers either.
Heather, you also spoke with Dr. Zachary Rubin, a pediatrician, about where this lack of data leaves parents. Let's listen.
It's a rather complicated, tricky situation for parents to be able to navigate, because they may not be able to control that situation as they're sending them off for other people to watch their children.
Heather, what can parents do to keep their toddlers and their babies safe?
Well, they're really left only with the basics, to practice good hand hygiene, to keep people home if they're sick, to avoid crowded places where, of course, the chance of contracting COVID-19 is greater. And beyond that, it's really just to stay hopeful and keep their fingers crossed that there will be a COVID-19 vaccine for kids under 5, perhaps sometime this summer. But that can seem a long time to wait, since these parents have been waiting for more than 2 years at this point.
And toddlers are so good at washing their hands, Heather.
Yes, you and I both know that, Brandis.
We know it very well. All right, Heather Cherone, as always, thanks so much.
Thanks, Brandis.
And you can read Heather's full story on our website. That's WTTW.com/news.